If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to the American Health Journal. I'm your host, Roger Cooper. In this special edition, we devote our entire program to a subject we ignore at our peril: dental care, our teeth, our mouths, our lifelong quest to keep and project a healthy, beautiful smile. Our expert and authoritative guide for this update on dental health will be Dr. Frank Hernandez of Hernandez Dental in Indio, who also teaches dentistry. During this program, you'll learn what the letters TMJ stand for and why they may hold the key to relieving chronic pain that you'd never guess begins in your jaw. And if you're one of those people who dreads going to the dentist and puts it off, we'll have some great news for you. No need to be afraid. Today's modern techniques that will make your fears about pain a thing of the past. We'll learn how a dentist watches to spot developmental problems in the mouths of young people and then uses the latest in orthodontics to head off trouble. It's not just about teeth anymore. We'll tell you why visiting your dentist regularly can be vitally important to your general health. Then we'll learn about the new procedures that have turned cosmetic dentistry into an art form. It all starts right now on the American Health Journal. First, we need to ask you about your TMJ. Do you know what your TMJ is? Dr. Frank Hernandez certainly does, and as an experienced dentist, he knows it can be the almost instant answer to relieving mysterious pain in other parts of the body. You'd never guess what your jawbone is connected to.
TMJ is the temporomandibular joint. It's the temporal bone of the head. It's the mandible, which is the jaw, and that's the joint that two bones come together. It's the most superior joint in the body, and I believe that in dentistry and for a lot of other medical situations, it's the absolute foundation of what is going on with the human body. A lot of times the joint is not in a position where it is favorable. It's in an imbalanced position. So, for example, the jaw is sitting like this in the jaw joint, or it's back, or some sort of orientation in the head where that's going on. A disorder for that joint would encompass a very great amount of symptoms. Head and neck pain, lower back pain, sleeping disorder. You could be a patient suffering from a lot of body pain, and you might not find out. You might be chasing all around, all kinds of different doctors going on there, never finding the problem. The body's got to stand on its 2 feet. If you have a joint that's dysfunction, and I don't care where it is, the body's going to make some sort of accommodation to stand up. So it's going to contort, it's going to move, it's going to do certain things that it has to do to accommodate that body balance. And if your TMJ is off, there can be a lot of things off from that. Your spine can get twisted, your hips can change, your feet, there's going to be a lot of things going on there for the body to stand up on its own 2 feet.
Well, I was suffering from shoulder and neck pain, very severe. I went to the emergency room one time, and all they did was give me a shot and some pain medication. Told me just to put some ice on and go away, And I went to a neck and back specialist for a little while. Took an MRI. Got no answers there. For 2 years, I went to physical therapy. I did acupuncture. I went to a chiropractor. I mean, you pretty much said I did it all. I hit the door. He did a few simple tests. Some tests. I took X-rays and photos and some sound tests of my jaw. he did some simple movement tests to see how I'd react, and then he said I had TMJ. I was suffering from TMJ. I was a little skeptical at first. I didn't think it would work. I didn't think how my jaw would affect my neck and my back and all this pressure in the back of my head. But at that point, I really didn't care, so I just wanted to come in and try it. So it was worth a shot. At that point, I was willing to do anything.
What we're going to do is we're going to orthopedically correct that. We're going to make something to bite on that you're going to correct that bite.
He put a little splint in my mouth, and then this ortho splint I put in my mouth, and it kind of just moved my jaw, set it correct a little. It set my jaw correct, and all of a sudden I felt better. It was almost instant. Like my neck pain started minimizing, started going away. I felt the pressure from the back of my head instantly go away, and I knew it was working. I've been a patient less than a year, about 8 months. And I feel great now. You know, I'm starting to go back to the gym like I used to, taking care of myself physically, and I'm able to concentrate. I go to school too part-time, so I'm able to sit there and concentrate like I never was before. I'm able to focus better. I was just really excited that it actually worked for once in my life.
I've always had headaches in my temple that I associated with stress headaches and other things associated with it. And when I came to Dr. Hernandez, he checked me for the TMJ, and he said that was probably associated with my headaches. So as soon as I was fitted with my bite splints, my day splint and my evening splint, I noticed an immediate improvement. My headaches were gone within a few weeks.
One of the basic things that we use is a splint or an orthotic device. Well, I guess the way that everybody can take a look at that is it's very similar to what a night guard looks like, or a mouth guard. But it's a lot more sophisticated than making a piece of plastic on top of your teeth. And then at night, it's a whole different process because your nervous system changes at night. It shuts down. It's on automatic pilot. So other types of situations are involved with that. So you need to make a device for that so that way the patient can relax at night.
I'm amazed at how well I feel. Just amazed at how fast it could work too.
I've been amazed at the treatment where we've seen patients really turn around in 24 hours. But everybody's different. It may take months to see that correction turn around. You can make a diagnosis from just a clinical examination on that, but I don't think you're going to be very accurate. We use a variety of instrumentation here. We use a joint vibrational analysis, which the more noise that a joint makes, the more sick it is. The most accurate device out right now is using a CAT scan, which is what we have in our office right now. There may be practitioners out there that everybody that comes to their office that they're going to treat, and they're going to treat with a TMJ treatment, and that might not be the right thing to do. The thing that I'm going to do is that I'm going to make an examination for that patient, and I'm going to see what's going on with them and make that determination as to whether is that the number one problem that their nervous system is calculating. You know, I know somebody very, very close to me that has this problem. A completely broken down jaw on the left side, and it's me. You know, I went through this treatment. I'm wearing a splint right now in my mouth. I couldn't hold my head up. My head hurt so much that it hurt to work. And I really came to a point where I thought, am I going to have to give up my career because of this pain that I'm going through? And I just had these nagging, persistent headaches that really knocked me out. And it was a problem. And so, you know, after seeking out treatment, I'm in class and I'm going through my manual and I'm looking at all these things that are being presented to me, and I'm saying, that's me. This is what I've got.
And you don't even realize that it has to do with your bite, with your jaw, and it affects your whole body because it could misalign your whole body, your whole back. I'm just amazed at how well I feel. I no longer have headaches in my temples at all. Never. I haven't had one headache there ever since I came here. Not one. And I always thought it was just stress, and it wasn't stress, because I still have stress.
If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.
Great-looking teeth, a great smile. You may not have them now, but you could in this day of great advances in cosmetic dentistry. Dr. Frank Hernandez sees it in his patients all the time. How just a little change in appearance can have a life-changing impact.
I think that with this idea of extreme makeover, that everybody's trying to get an edge on this look. And one of the fastest ways of taking care of that situation is cosmetic dentistry. But what I do in examining somebody for cosmetic dentistry is I really take a look at what's happening to create that situation and then incorporate that in my treatment plan for the patient. I think one of the best things for your practitioner to be is a good listener. What do you really want? What do you want to achieve with your smile? One of the biggest things that I go through with cosmetic dentistry is that the bite might not be the type of bite that you can put on these nice porcelain finishing things on your teeth and get the result, because something's going to happen along with that bite later on to make a problem for these added things to the bite. One of the things with cosmetic dentistry is that if the bite is a certain way, why is the question that needs to be asked? Why did it get like that? And I think as the dentist, it's very easy to come in and say, I want to spend so much money and I want a new front grill. And what are we going to do? You know, and I think that as a dentist, I think that the dentist needs to be more conscientious of what they're giving the patient. Developmental orthodontics is an approach to orthodontics where you consider how did the person develop and how did they get to this situation, and what are the factors involved that got this child to grow and develop in this way. For example, this person is got a narrow bite, it's got some teeth sticking out, and some treatment plans on conventional orthodontics are to pull teeth. Well, I think that's not the approach that I like to take with a patient like that. I like to get that development out. Seek out what that development is in that child's growth and attack that. Widen the bite. Make those teeth fit in that same space, because that's what they're supposed to be. To get to a diagnosis to put on braces, what I do in my office is that I start off with the most basic form of x-ray. That's a panoramic x-ray. We take a head shot where we do this diagnostic tracing on that. We take a CAT scan of their jaw joint. I want to see if there's a problem with the jaw joint, no matter how old the person is. So we're going to incorporate a lot of different technology to get to a diagnosis, to get to a treatment plan. Before we even put braces on, this patient is going to go through a very extensive fact-finding situation. And I do more than what is required to get to my answer, to find out why. That's the biggest part. Answer that question why, and you're going to have a good result. With my treatment, I very rarely put braces on right away, because invariably with these patients that I see, most of these patients have developmental problems. They lack development. So we want to get the jaw to expand, to move, to grow. We want to expand the bone if we have a crowded situation. I don't use a cookie cutter approach where braces go on and it's 24 months. And that's usually the rule of thumb with it. It takes me a lot less time when the brackets go on, because those are just the finishing touches for my orthodontic situation. The transformation that some of my patients have gone through is just, it literally, it's what I want to show up for work for. You know, that's the reason that, you know, sometimes I see a very clear purpose as to why I'm doing what I do. I'll give you an example. A mom came to me and she went to three dentists, three orthodontists, and every one of them said that your kid has to have surgery, and he was 8 years old. And she came to me and she says, "What can you do for him?" I says, "I think I can do this without surgery." He was going to have his jaw cut and wired at 11 years old. I says, "You know, this is something that I do." And we're finishing up with him right now. And mom and dad are absolutely ecstatic that their son didn't have to go through maxillofacial surgery to have this orthodontic problem done. You know, that for them to tell me that they are so happy, that they were so glad that they brought him to my office, you know, I want to show up tomorrow for work. That's it.
If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.
If you haven't been to the dentist lately, and you should have, you probably have no idea how things have changed as modern dentistry progresses. Dr. Frank Hernandez updates us on the latest technology.
What is interesting about dentistry is that you can hear dentists advertise that they are state-of-the-art. And you know, really your dentist this is what it is right here. You know, you got good hands or you don't. You know, that's your dentist. But there's a lot of things that can happen, you know, as far as equipment that make a more pleasant experience these days. We have digital radiography, we have intraoral cameras, we have abrasion techniques where this little particle of sand comes out and makes a hole in your tooth. You know, there's lasers, but you know, and some of these things are nice on that, but you know what it ultimately comes down to is the hands of your dentist. You know, if he's got good hands, he or she has good hands, that's it. That's your state-of-the-art dentistry. The field of dentistry is more closely related to other forms of medical practice, and I think that patients today are employing their dentist as part of their health team more than they used to. And I think that is a big part of this information age, that dentists are more informed than what we used to be. I think that there is a wide spectrum as to why people come to the dentist. They want a nicer smile, they're in chronic pain, and I think that your dentist has a lot more answers than what he used to, rather than just, he can still fix that little chip. He can still put that crown on that we need to replace the filling and do some of these routine dental procedures, make your smile nicer. But the dentist has a lot more important role as far as your medical health. If you find that a person has a lot of issues with their mouth, a lot of missing teeth, a lot of decay, a lot of these periodontal situations, you're going to see the health of that person more compromised. And I think that the dentist has more of a job today as far as making these connections and referring these patients to the proper physicians. We need to go to the dentist on a regular basis. We need to be checked by your regular physician. We need to do these things. This is something that needs to be done. And the dentist we have a lot of equipment these days that we can get over these phobias and these fears, these dental fears that come up they're not there anymore. I think the dentists these days are more equipped to deal with that concept of pain than we ever have. We have equipment, we have techniques. We're using things that we've never used before. They use hypnosis. They use more calming type of dialogue. We're mentally preparing the patient to deal with these fears. We're taking care of these things these days.
He was wonderful. I had very, very bad experiences at a dentist at a young age. When I finally did get my teeth worked on, 2 weeks straight in a row, very, very, very bad experience. Dr. Hernandez, now I love coming here. I have no fear at all. In fact, I look forward to it.
He's very gentle. He lets you know when he's going to do whatever procedure. And I've never really been uncomfortable as far as pain.
From my perspective, as far as pain, that's not really an issue in today's dentistry. If you take care of things properly, deal with infection, take care of the patient in those proper order, you're not going to deal with pain with dental procedures. It's just not happening. The dentist can clean your teeth. Most offices have a registered dental hygienist that is licensed in the state of California to clean your teeth, and he or she is up on the latest things, because that's a specialty of dentistry in its own right, I think. And that is, as long as you are up on your education, there's new things coming across that they're finding all the time, that the mouth has this, the mouth has that, these germs have these things, this bacteria is now resistant to antibiotics. The hygienist is up on that, and they're a specialty, like I said, in their own right. That's the person that you need to see on a regular basis as well.
I've been a patient of Dr. Hernandez for 12 years. And the reason I keep coming back is because he is not only a dentist, but he treats you like a friend that he really cares about, takes an interest in you and your family. And personally and professionally, he just has a very nice atmosphere in his office.
If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.
It's another reason to see your dentist. In the course of checking out your dental health, your dentist is in a unique position to spot other serious health problems that might need your attention. Dr. Frank Hernandez tells us about the role your dentist plays in helping you breathe easier.
When you're taking on an examination and you're looking at growth and development, you're looking how somebody came to be the way they are. And we've got some issues there. Teeth are crooked, palate small. That one of the factors of it is airway. And can you breathe okay? You see these kids coming in here and their tonsils are falling out of their throat. And you look at their mouth and their teeth are crowded and their tongue is popping out every time they swallow. They're snoring. They're having trouble sleeping. This is a fact of that 1/3 of the U.S. population has a sleeping disorder, whether they're old or young. They're not sleeping well, and one of the main problems is, are they breathing okay? And I think that is a big issue when you're examining somebody, because this is not something that I as a dentist take care of, but it's something that I need to be responsible for as far as properly referring that patient out to the proper physician. Airway is one of those issues. It's got to be taken care of. It's got to be dealt with in order to make the result a good result in whatever dentistry that you're doing. Most of the time when I deal with this type of problem is that I'm dealing with an orthodontic evaluation, and that's one of the basic things that I'm going to do is look at the TMJ as far as stability, and also look at their patent airway. Airway is going to make or break the orthodontic stability. If a child is going to go through, or an adult is going to go through braces, and they've got this large tonsils sitting in the back of their throat, and they're swallowing improperly, and their muscles are moving improperly, and they're mouth breathing, something's going to give, and it's going to be the teeth. So we're going to get relapse to that. This is what's going on. The oral environment, the teeth, that's the train wreck that happens with that. If someone's not breathing properly, the mouth is going to get that end result for that dysfunction. If you're breathing inefficient, there are other systems in the body that are going to suffer. So it's got to be dealt with on that. And the dentist is going to be able to make that evaluation at the beginning.
If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.
Brush as you might, they just don't seem to get white. Need some advice on keeping your teeth bright? Dr. Frank Hernandez is up on the latest techniques that can turn your teeth white.
You know, whitening teeth is all a part of cosmetic dentistry, and it's easy to do. There's a lot of different products out there. There's some really neat products out there. One of the difficulties about whitening teeth is the teeth becoming very sensitive, and the gums feeling very tender when they put this chemical on your teeth. So, you know, there's things that you can do and things that you can accomplish to kind of care for that. But it's probably one of the biggest booms in dentistry coming out, that it's something that you can do. Kids are doing it at home. You're buying it at May Company. You're getting it all over the place. You're applying this chemical on the tooth, and this chemical has some sort of oxidation process, and you're literally etching the teeth. So microscopically, you can view these teeth and see these little roughenings of the surface of that. And one of the important things that we do in our office is that we smooth out and apply fluoride and do a process that will actually strengthen the teeth, because I think whitening really does weaken the teeth ultimately. Once you do your whitening, you're going to always want them white. So you're going to have to retouch up these whitening situations. So eventually something's got to give after years and years of whitening, and it's going to be your enamel. That's just from my point of view. Well, the brushing, I think it's a big part of marketing, because we're into that cosmetic and makeover sense of mentality right now, and whitening is a big grab at the market. If you take a look at all the toothpaste on the market row, there's a ton of them from the same company. Does it really make a difference? I think you have to ask yourself, does it really make that much of a difference in buying that one over that one, when you're really trying to do one thing when you brush your teeth, and that's take away the bacteria that the plaque is building up? And the bacterial buildup in the mouth is what the cause of periodontal disease is. So I think the purpose of brushing is just that. If you're trying to do something extra, the best hands of those things are in your dentist's. If you have a situation where it looks okay, it's best to leave the teeth alone. Intact enamel is probably your best bet. If you really want to do it, there's some products out. The less exposure that you put on the teeth, the better. So there's these new products out, for example, like Zoom and products similar to that their product is that their exposure to the enamel is very quick. And I think that you can put on, for example, 2 to 3 applications that are 20 minutes apiece, and that'll be it for a couple of years. So that's one of the best products I think that's out there right now today.
And that's this edition of the American Health Journal. We'd like to thank Dr. Frank Hernandez of Hernandez Dental and his staff for sharing their information on state-of-the-art dentistry. Thanks for joining us. I'm Roger Cooper for the American Health Journal.
If you have any questions on the topics you've seen today, please call Hernandez Dental at 347-7196. The staff will arrange a private consultation with Dr. Hernandez. That's 347-7196.